Alert tonight as the Food and Drug Administration issues a new directive to doctors warning expectant mothers about a possible link between Tylenol and autism. Pregnant women are now moving forward, being urged to limit the use of this pain reliever while they're expecting. Joining us now with more on the directive is Cookeville pediatrician Dr. Leslie Treese. Dr. Treese, I appreciate your time. I know this is very fresh. Let's start with facts. The rates of autism have been markedly increasing in recent years. The latest thing I saw from the CDC earlier this year now says 1 in every 31 children. What do you make of the latest numbers and this possible connection between Tylenol or acetaminophen and autism?
So thank you for having me. And the rates of autism have increased in large part due to additional identification. So the diagnostic criteria were broadened in 1994 and then again in 2013. And we have better screening tools now. We actually screen children for autistic spectrum disorder with something called an MCHAT, and that's done. It's the modified checklist for autism in toddlers, and that's been done for the last few years. But we screen children at 18 months and 24 months for this, and that's one way that we're picking it up. We also just recognize it more in adults. So I think there are a lot of adults that are actually being diagnosed when their child gets diagnosed, or perhaps health professionals are recognizing it more even in the adult community. So that is felt to be a large contributor to this increase. Now, certainly there should be ongoing research. We definitely need to look at all of this. But speaking to the Tylenol connection, there was a meta-analysis, or they couldn't even do a meta-analysis on this review. There was a review of a bunch of studies, and I think it was out of Harvard, but they looked at all of the numbers, and the results were so scattered among those studies. Some said yes, there was a link, some said no, there wasn't a link, and there was a lot of confounding factors in those studies.
Well, let me ask you this. A lot of parents are going to have questions. What do you intend to tell your parents when they invariably ask, hey, what should I do? I realize I'm not pregnant anymore, but I'm concerned about my child developing any kind of an issue. What are you going to tell them?
Well, there's definitely no issues with giving your child Tylenol in appropriate doses when your doctor tells you your child needs Tylenol. But as far as pregnant women taking it, they should have a conversation with their obstetrician. And there are certain conditions like fever that happen in early pregnancy that can actually lead to birth defects. So we need to always be careful to check with your doctor. Well,
obviously a lot more to learn, and I think your advice is excellent. Cookeville pediatrician Dr. Leslie Treese, I know these are early days on this. Thank you very much for offering some thoughts.
Thank you.